Ever wondered how a pharmacist transforms raw materials into the medications we use daily? It's a meticulous process known as pharmaceutical compounding and dispensing. Let's break it down. Compounding is the art and science of creating personalized medications, combining multiple ingredients to tailor a medication that meets a patient's unique needs. It's essential because it allows for customization of strength, dosage form, flavor, and more, going beyond the one-size-fits-all approach of commercial medications. The pharmacist plays a critical role in this process. They are the skilled artisans, the healthcare professionals who measure, mix, and dispense the medication, ensuring it's both safe and effective for the patient. They are the bridge between raw materials and the final product that aids in our healing. Stay tuned as we delve deeper into the fascinating world of pharmaceutical compounding and dispensing. Pharmaceutical compounding is a meticulous process that involves several crucial steps. Let's break these down. Firstly, we have the calculation step. In this initial phase, the exact amounts of each ingredient needed for the medication are determined. This is based on the prescription and the dosage required. This step is vital as it ensures the accurate proportion of each ingredient, which is key to the effectiveness of the final product. Next, we move on to the measurement step. Here, the calculated amounts of each ingredient are carefully measured using precise instruments. This could include a balance for solids or a graduated cylinder for liquids. The accuracy in this stage is paramount, as even a slight deviation can impact the medication's potency or safety. Once everything is measured out, it's time for mixing. This step involves combining all the ingredients together in a specific order and manner. The mixing process can be a simple stirring, or can involve more complex procedures, like trituration or levigation, depending on the nature of the ingredients. This step ensures that the ingredients are uniformly distributed throughout the medication. After the medication is compounded, we move into the quality control phase. This is where the compound is thoroughly examined to ensure it meets the necessary standards. It might be tested for things like consistency, potency, and purity. The medication is only approved if it passes all these checks. Lastly, we have the packaging and labeling step. The medication is transferred into appropriate containers and clearly labeled with all the necessary information. This includes the patient's name, the name and strength of the medication, and the dispensing date. This step is crucial for the safe use of the medication by the patient. As you can see, each step in the compounding process is critical to producing a medication that is both safe and effective. It's a complex process, but with careful attention to detail, it ensures that patients receive the precise medication they need. Now that we've covered compounding, let's move on to the second part of the process, dispensing. Dispensing is the final crucial step in the pharmaceutical process, where the medication prepared is handed over to the patient. This involves several critical steps, each designed to ensure the safety and health of the patient. The first step in the dispensing process is prescription review. Here, pharmacists meticulously examine the prescription provided by the doctor. They look for any potential issues such as incorrect dosages, contraindications, or possible drug interactions. This step is the first line of defense in preventing medication errors. Next comes the dosage calculation. Pharmacists must ensure that the prescribed dosage is appropriate for the patient's age, weight, and health status. This involves a careful mathematical calculation and a thorough understanding of the medication's effects. It's a step where precision is paramount. Once the dosage is confirmed, the medication is labeled. The label provides critical information to the patient, including the name of the medication, the dosage, the frequency of use, and any special instructions. The label also serves as a reminder for the patient, helping to ensure that the medication is used correctly and safely. The final step in the dispensing process is patient counseling. This is where the pharmacist educates the patient about the medication. They explain how to take it, what to expect, potential side effects, and what to do if a dose is missed. This step is crucial in making sure the patient understands how to use the medication properly and what to expect while taking it. Throughout the entire dispensing process, the pharmacist plays an essential role. They act as a safeguard, ensuring that the correct medication is dispensed and that it's safe for the patient to take. They also provide valuable education, helping patients to understand their medication and use it correctly. Each step in the dispensing process is designed to ensure that patients receive the right medication in the right dose and know how to use it properly. Scene script. Accuracy and precision are key in both compounding and dispensing. But why? Well, let's dive right in. Accuracy in pharmaceutical compounding and dispensing refers to the ability to deliver a medication that exactly matches the prescribed dose. This is critical because each prescription is carefully calculated by healthcare providers to provide the right amount of medication based on the patient's unique needs. Now, precision, on the other hand, refers to the ability to consistently deliver the same dosage over and over again. This is equally important because inconsistent dosages could lead to fluctuations in the concentration of medication in the body, which could impact the effectiveness of the treatment or even cause adverse reactions. So imagine this. You're expecting a package to be delivered, but it arrives at your neighbor's house instead. That's inaccuracy. Now, if the delivery person keeps dropping off your packages at your neighbor's house day after day, that's lack of precision. In the world of pharmaceuticals, these missteps can have serious implications. An inaccurate or imprecise dose could lead to a medication being ineffective, or worse, harmful. For instance, too little of an antibiotic could fail to treat an infection, while too much could lead to antibiotic resistance. Similarly, an inaccurate dose of a blood thinner could result in a clot or a bleed. An imprecise dose could lead to fluctuating drug levels, making it difficult to manage conditions like epilepsy or bipolar disorder. Moreover, compounding and dispensing aren't just about the right amount. They also involve the right ingredients, the right mixing process, and the right packaging. A lack of accuracy or precision at any of these stages could compromise the quality and safety of the medication. By maintaining high standards of accuracy and precision, pharmacists can ensure that patients receive the right medication in the right dose at the right time. This is not just about meeting regulatory requirements or industry standards. It's about safeguarding the health and well-being of patients. In this highly precise field, there's no room for error. In the world of pharmaceuticals, regulations and best practices govern everything. These guidelines are not just bureaucratic red tape. They're crucial for ensuring the safety and well-being of patients, along with the efficacy of medications. Pharmaceutical compounding and dispensing are subject to stringent regulations. For instance, the United States Pharmacopeia sets forth specific standards for compounding sterile and non-sterile preparations. These standards address every aspect, from the cleanliness of the compounding environment to the quality of the raw materials used. Similarly, in dispensing, pharmacists must adhere to regulations set by federal and state laws. These laws dictate everything from proper labeling to the secure storage and disposal of medications. They also require pharmacists to provide counseling to patients about their medications, ensuring that patients understand how to take their medication correctly. In addition to these regulations, there are also industry best practices that pharmacists should follow. These best practices often go above and beyond what is legally required, focusing on the highest level of patient care. For example, pharmacists should always double-check their work, verify the appropriateness of the prescribed medication for the patient's condition, and engage in continuing education to stay up to date with the latest developments in their field. Adherence to these regulations and best practices is not simply a matter of checking off boxes. It's about ensuring that every medication is compounded and dispensed with the utmost care and precision. It's about reducing the risk of medication errors and adverse drug events. Most importantly, it's about making sure that every patient receives the best possible care. In this light, compliance is not just a requirement, it's a commitment. A commitment to professionalism, to patient safety, and to the health and well-being of the communities we serve. Remember, in the field of pharmaceuticals, every detail matters. Every step, every procedure, every protocol plays a vital role in patient care. So let's commit to excellence, let's commit to best practices, let's commit to patient safety. Compliance with regulations and best practices is not just a requirement, it's a commitment to patient safety and health. Pharmaceutical compounding and dispensing may seem complex, but it's all about precision, accuracy, and patient safety. We've taken an in-depth look at these processes, starting with the meticulous steps in compounding, from ingredient selection to final formulation. We then moved on to dispensing, where attention to detail is paramount, ensuring the right patient receives the right medication at the right dose. The significance of accuracy and precision cannot be overstated. Even the smallest error can have significant consequences, hence the need for stringent quality control measures. And let's not forget the regulations and best practices that govern these processes, designed to uphold patient safety and ensure the highest quality of pharmaceutical products. Pharmaceutical compounding and dispensing is an art, a science, and a responsibility. And it is this combination that makes it a fascinating and vital part of healthcare. Thanks for joining us on this journey into the world of pharmaceutical compounding and dispensing. Subscribe for more.